Welcome all of you to the next podcast of IJDDC, or the International Journal for Diabetes in Developing Countries, which is the official journal of RSSDI, our Research Society for the Study of Diabetes in India. And we have none other than our editor in chief, Dr. Rajeev Chawla, sir, today for discussing a very interesting aspect which is going to get published, and another study which has already been published in the December 2025 edition of IJDDC. The good news is that every member of RSSDI can access the journal completely free of cost just by going onto the website and logging into the members area. So use your credentials and access this fantastic journal with great scientific information and great articles submitted there from all the countries around, giving you free access to all that information.
Thank you. Thank you, Dr. Purvi. Good evening, everyone. Thanks for having me for this podcast. Yeah,
So, without much ado, I think to understand both the studies that we want to discuss, it will be important for our audience to understand what MASLD, or metabolic dysfunction associated steatotic liver disease, is.
yeah. Dr. Purvi, as we all know, early days we were talking of fatty liver disease and then NAFLD going into NASH and ultimately these patients developing chronic liver disease. 2020, all major international organization, ACE and ADA, actually recoined a new terminology for that. That is MESLD, that means metabolic dysfunction associated steatotic liver disease. This was actually retermed or recoined because of the fact that when earlier we were talking of NASH, that means it is non-alcoholic fatty liver disease or non-alcoholic steatohepatitis. So one thing was we wanted to remove that stigma of alcohol because many patients will not like if you ask them whether they are taking alcohol or no, especially female patient and many Indian ethnicities or Indian religions, they don't take alcohol at all, so they might feel offended. So that way, and second important thing is whenever you talk about MESLD, because very fact the term is that it is metabolic dysfunction associated steatotic liver disease, it carries a lot of prognostic value because it tells you that there are comorbidities either in the form of pre-diabetes or maybe IFG or IGT. So there is a dysglycemia, and along with dysglycemia, you have raised enzymes, you have more than 5% fat, which is there into the liver. So the evidence of more than 5% steatosis stateway, along with other comorbidities like dyslipidemia, hypertension, raised enzymes, or maybe ultrasonic evidence would tell you that patient has MESLD.
Fantastic. So clearly explained. Sir, but why is MASLD so important in the Indian context?
Yeah, very good question again. That because last close to 10 years now, we have a lot of evidence. Earlier, we thought that it will only happen if you were taking alcohol, but over the time, we have seen many patients and a lot of evidence has come in various studies that MESLD is now as common as 35 to 60 or 65% in patients, those who have poorly controlled diabetes, those who are obese, those who have dyslipidemia, and those who have other comorbidities. So overall, the prevalence of MESLD over last 10 years in various studies, it has been seen up to 60 to 65%. And many of these patients, maybe 10 to 15%, they may ultimately end up with chronic liver disease or even HCC, hepatocellular carcinoma. So that risk is very, very high. So if you intervene early, many times you may be able to check the progression of chronic liver disease or movement towards chronic liver disease.
Fantastic. I think the relevance is very well explained. So just taking this discussion forward, the first comorbidity you mentioned was dysglycemia and then diabetes. So, sir, the studies that you are reporting in IJDDC, are they with MASLD and diabetes?
Yeah, in fact, two studies of ours are already published. One got published in October, November, December issue of 2025, which was on semaglutide, and we had a 18th month data of 196 patients. So it was a very huge data, and all these patients, they were proven to have MASLD on fibroscan. So we had two scans of each patient right in the beginning when they were enrolled for the study. And that time, because we didn't have injectable semaglutide, so they were started on oral semaglutide, and they were followed subsequently, not only in terms of improvement in their hepatic enzymes, but also FIB4 score, and also CAP score was also observed, and their fibrosis marker was also, KPA was also observed on two occasions, one at baseline and one toward the end of the study. And you will be surprised that over 18 months in 196 patient, which is a twin center data, mine and Dr. Shalini's data, we found that there was close to 2.3% reduction in HbA1c, which was very, very significant because baseline HbA1c in this overall heterogeneous population was 10.3. So that means they were having higher HbA1c. Obviously, their HbA1c reduction was also very, very significant, close to 2.3 or 2.4. Not only that, there was a significant improvement by almost 25% in hepatic enzyme. Their FIB4 score also improved by 20 to 25%. There was improvement in overall lipid profile also, and even on fibrosis, when it was assessed by fibroscan, there was an improvement. So overall response was very, very good. So this is how we highlighted that GLP-1 receptor agonist in patient with type 2 diabetes, those who have already having established method as assessed by fibroscan in terms of more than 5% steatosis, along with the raised enzymes, and FIB4 score was more than 1.35. So they were enrolled, and we found significant improvement in that. And the second study, which is shortly going to be online, that is on tirzepatide. That is a 4-month data on that. Again, we wanted to see that this drug being a twin agonist, both
Let me
GLP,
just
yeah,
interject,
yeah,
just to get some more
yeah,
perspective on semaglutide, because I
yeah,
think your findings are extremely relevant. We saw how the prevalence is high in India and how this will become relevant. Also, semaglutide goes off patent in this month itself, and I think that also clears it paves the way for further treatment of MASLD or tackling diabetes better with GLP-1, especially in those with MASLD. I think that's a huge finding and a huge report coming out from India from two centers, as you mentioned. Sir, I also wanted you to clarify if it's possible, were these patients on SGLT2 inhibitors as well?
yeah.
How many of them were there? And was there any use of saroglitazar as well? Because we know that saroglitazar not only for hypertriglyceridemia, but also for MASLD, it's being used in India quite widely. So,
Again, it is a very, very relevant question that because this was, see, a real world data, these were not randomized, it was not a randomized controlled trial. So they were on standard care, close to 45-50% patient. They were on SGLT2 inhibitor also, other than being on metformin, and many patients were on seraglutide also. Although we looked into this, although we have accepted in our study also, there are certain limitations. We couldn't do a liver biopsy in any of the patient. Moreover, they were already on standard care. I told you, like on SGLT2 as well as on metformin, and along with cerebrotizar in many patients. So these all drugs are also likely to improve overall message. But I think regression analysis, once we did, we found that it was primarily the impact of semaglutide, which was very, very apparent in our study.
very pertinent findings itself. Of course, we should add pioglitazone also to the same. But we'll move on to the second study that you were talking about, the upcoming publication with tirzepatide. And I think that's a shorter study, if I recall the details. It's a 3-month, 12-week study.
4 months
4 months,
data.
yes.
Yeah.
So if you can elaborate
So
on the study design and
yeah, this
details.
was also 4 months data, and in fact, honestly, we thought that we should earlier report it. That is why we didn't wait even for 24 weeks data. We could collect 132 patient, again a twin center data, and these patients were not only having type 2 diabetes, their BMI was also high. BMI was close to almost 28, 28.5, and within 4 months we found an average mean weight reduction close to 9 kg, which was almost 8 to 9% of their baseline BMI. There was again 10 to 12% improvement in hepatic enzymes, as well as FIB4 score also improved in these patients. So we said that when earlier we said that GLP-1 receptor agonists, we know that not only they improve glycemia, they also improve all hepatic enzyme through their antifibrotic mechanisms. Also, they reduce inflammation, and we know the core mechanism for MASLD, if you know that it is primarily insulin resistance into the liver. So we know that whenever there is a severe insulin resistance into the liver, so there is lesser glycogenesis, more of neoglucogenesis under the impact of glucagon and overexpression of alpha cell. So that actually keeps carrying the overall cascade. So not only there is a reduction in adiponectin, free fatty acid levels are on the higher side, TGs go on the very, very higher side, and all the markers of inflammation, simply you may say TNF alpha and IL-6 and many markers are available which you can actually these days look for. All these markers are on very high side. So moment you give a drug like GLP-1 receptor agonist or GLP-GIP twin agonist, they tend to reduce inflammation, they tend to reduce insulin resistance into the liver. So there is overall improvement in the metabolic milieu. That is how not only enzymes come down, steatosis significantly gets reduced, but there is also improvement to some extent by 15% into the fibrosis marker also, what we saw on fibroscan as well as on FIB4 score.
Fantastic. I think that is a very, very relevant finding in this Indian setting, because I think insulin resistance is our primary concern among Asian Indians and Indians in particular. So I think this study is really going to take us a long way in understanding, and thank you for throwing insights on the molecular mechanisms as well. Very pertinent again, sir, to understand this. So yes, I think both are very interesting reports that you have published in IJDDC, and we look forward to actually learning more and taking those findings into our clinical practice as well. So thank you again,
I
sir, for
think we'll be
sparing
very
time.
happy if all the members of ISAG could access those studies, and hopefully it will be of some help in them in clinical practice. And it again motivates us that after metformin today, especially when semaglutide is going to be off patent, ideally these drugs should be the first line option after metformin, not only to get good glycemic control, to cut down on weight, and independent of the weight, we know there is going to be some improvement in OSA, risk of gout goes down, and MASLD also significantly improves. Risk for atrial fibrillation also goes down, and overall, all metabolic values starts improving. So I think this is going to be the changing paradigm in management of diabetes or obesity.
Undoubtedly, sir. And I think the way India is exploring with the burden of non-communicable diseases, including all these metabolic parameters that are going, that are being increasingly seeing deranged even in our younger population, we need newer therapies and we need such findings to be reported as soon as it happens. So thank you again, and I congratulate you and the entire team of authors, including Dr. Shalini Jaggi as well, for this important data and report. And sir, once again, particularly thanks to you for sparing time
No, no.
for IJDDC and doing the
Pleasure is all mine, and thanks a lot for having me on this podcast. And I'm sure this will be of great use to all the readers and the members. Thank you, Dr.
So, readers and RSSDI members, do not forget you can log in. This is going to be simply in your lap. You just have to log in using your credentials on RSSDI website and free access to the entire IJDDC volume of articles. So don't miss this treasure trove that is being offered to all RSSDI members from the official journal of RSSDI.
Thank you, Dr.
Thank you.
Purvi. And I'm sure you are a social media editor for our journal. And today your voice is very, very loud. And it is, I know you are so well connected. So I'll be very happy if it reaches to every member through social media.
So
Thank
it's
you.
going to be a
Thank you very
persistent
much.
endeavor. Thank you so much.
Thank you.
And a big thank you to our tech team as well,
Thank,
Adarsh and Shaurya and all of you.
thank you. Thank you.
Thank you so much.